All right. It never fails. The technology never fails. No matter how many times I think I got it together. All right. So welcome, welcome, welcome. This is our practice questions only. So for those that attended the last practice questions only, it was on March 21st. So those were actually some new debut questions. And so that class is different than this class. This class is actually my original practice questions only. So if you've been with me for a while, the questions may look familiar. But if not, then we're going to kind of dissect and go through the questions to show you how to really approach breaking down the questions. So, of course, before we get started, I wanted to just give you a overview of what I have going on. And yes, everyone, go ahead and feel free to chat me if you have any questions. All right, so I do have a lot going on. So we have two free classes tonight, and then next week is also free. It's about how to get started. It's a good motivational class, even if you are midway in studying. It's just good to kind of see, or if you're trying to figure out what to do about how to get started and really where to start. Even if you've studied before, it's a good class to attend. So that's going to be free as well. And what we're going to do for the month of May and also for the month of June is we're going to restart my series. And what we're going and we're going to have ethics, developmental theories, direct practice, diagnosis and medication, macro, and then another practice questions. June 20th will be not the same as tonight. It'll be different. Okay. So for those that don't know kind of some of the deals that are going on right now, I do have the classes are free if you purchase a replay bundle. If you purchase any replay bundle within the last what's now April in 2024, you can maximize and get some free classes. So I have 6 classes. So if you got free classes in the last series, you wouldn't be able to get them every time, but you do get 6 free classes with your replay bundle. So I have that. Also, if you had my bundle for longer than just this year, then I have also a deal for you. Just email me and we can talk about that. Okay, let's get to why you're here. The like method. So let me just give you a little bit about me. I think most of you all know me, but just in case I have anybody new, if I have anybody new, let me know in the chat. And also let me know in the box on Facebook as well. Oh, new. All right, new. Yay. Okay, great. Welcome, welcome, welcome. So just to let you know, normally when we have a class, I'm not streaming to Facebook. So we typically get right started. So we normally don't have a long delay. Those that know that have been in my class before, I definitely hit the ground running. But this is kind of the format. We go over a little bit of information. And then we also do questions. So tonight we're going to just do questions. I'm going to give you a little bit about the style of the liked method. So the liked method is something that is not necessarily going to tell you what to answer. It's not going to say, hey, the answer is this, but what it will do is slow you down a little bit. And I will preface it by saying it's not that everybody likes this method, but it is my preferred and what I use in all of my materials. And I also encourage you to use it as well. So a little bit about me before we get started. My name is Dr. Sapphire Boom, and I am the owner of Advanced Social Work Solutions. The reason I started my business is because I really wanted to be able to allow all people to access my materials and the things that I've learned in training MSW students for the past 12 years now. So that's my specialty. I love talking about licensure prep. One, because in the state I live in, which is Maryland, it is right now a mandatory thing to get in order to be to practice as a social worker. But also just in general, there's been some challenges with the exam, as we all know. So it is really my purpose and commitment, and it's my passion to show you how to crack the code to the exam, so that you don't have to waste a whole lot of your time. So I hope that I can give you a little shortcut and help you and guide you. Is this geared towards the MSW? So the answer is yes. My material is geared towards the MSW, but I have a lot of clinical test takers that also take my material, and here's why. If you notice, a lot of the material will say master's and clinical because the amount of lap, there's a lot of overlap, right? So human behavior doesn't change, okay? Ethics doesn't change by the exam. So right there are two areas of the exam that are the same for all levels. The difference is the focus, right? They are different percentages in each of the exams. So that's kind of the difference there. So human behavior, ethics, both the same, okay? Macro, right, which comes up under interventions, but the macro practice is also the same. That does not differ between master's and clinical, right? In terms of what you need to know about it. So that's the same as well. Where the difference does come in is with the clinical interventions, right? So on the clinical side, of course, understanding clinical interventions is paramount. On the master's level, you need to know a basic knowledge of what clinical interventions are, and that's what I provide in my direct practice class. But for my clinical test takers, I always tell you, make sure that you are digging a little deeper into the clinical interventions, right? Understanding those therapeutic modalities, making sure you know what the common uses are, which populations there are commonly known for, right? So for example, DBT equals BPD, right? Borderline personality disorder. That's an example. And then the other area, I do go over diagnosis and medication. Again, more for symptom recognition. Whereas honestly, what I have been told is that the clinical doesn't really have a whole lot of diagnosing and medications on it. A lot of scenario-based questions. So in that regard, what I would say is that you do need to know about differential diagnosis and should know a little bit more about the disorders than just symptom recognition. You should have a little bit more information. So that's the main differences. Right now, I do not have any material specific for the clinical. And I totally understand if you're like, hey, I want material that's specific for the clinical. That's no problem. But what I can help you with and what this class will do is this class, and again, those other areas that I mentioned are for all exams, because no matter what, you still have to know how to break down a question, right? I would say it is probably 80% mindset, right? 80% mindset, 60% topics. Wait, that doesn't math, right? But it's a lot of mindset, and it's a lot of how to break down the question. You actually understanding the material is good, and it is a foundation to studying. But in terms of what will actually give you that pass, those two things are probably more, in terms of probability, a factor than really the knowledge. Because honestly, we're all pretty good with remembering. Or even if we have trouble remembering, we were able to get through an MSW program, right? So your ability to study is typically pretty good. You might just need help in terms of what topics, but it's typically pretty good. So what ends up happening is really you're not understanding what they're looking for or what they're asking. And also in terms of your mindset, the anxiety creeps in and takes over. And when that happens, your ability to process, concentrate, and break down questions then can be impacted, right? So what I'm here to do is really just teach you about what to look for and to be able to understand the questions. So for those who are new, here is the like method. Reading the last sentence first is key because it's going to give you your indicators about what it is looking for. Okay. You're going to hear me say test world, real world. They're very, very separate. I wish I could tell you that they are matching, but they are not right now. You do have to have a totally different mindset. And without getting too deep, if you fall within one of those categories that have a disparity in pass rates, your mindset has to change even more, right? So those that fall into the African American population or any kind of minority group, that's going to be key. Also, the older, those that are older who are taking the test, and also those whose English is not the first language. Those three areas, your effort into making sure you understand what the exam is asking for will be a little bit greater. And so I'm going to be here to help you with that. You want to identify the type of question. Now, this step, a lot of people struggle with. So I don't want you to be struggling. I just want you to know that you should be familiar with different types of questions. And I'm going to show you what those different types of questions are. Okay. And then key concepts. You need to know what's important, what's not important. Eliminate it down to 2 answers. We know that now there are options with 4 answer options and 3. Okay. To my knowledge, it has not gone all the way to 3 only, but it is supposed to be coming. Okay. Then you want to identify your distractor. Obviously, you probably have no problem getting it down to 2, but it's typically like could be a toss up. And so these other steps are going to help you with which one to actually select. And let me tell you, this journey is not only professional and academic, but it's also personal. Because what ends up happening, and I've done a couple of groups with these over the past couple months, and what ends up happening is you get upset a little bit, right? You're like, Dr. Boom, this doesn't make sense. Why is this the answer? Like, it shouldn't be the answer because in real practice, and you'll kind of get in your head about it. So don't do that. There is a method to the madness, and I want to kind of share it with you. Now, there are questions that when you look at them, you'll be like, I have no idea, and that's okay too. But we want to help you really understand how to determine what they're asking. A lot of times we pick the social worky answer, but the problem is all of them are social worky. So you have to make sure that it fits what is going on in the question. Here are the different types of questions. We have 2 different formats: recall, reasoning, right? Recall, definition, reasoning, scenarios. And then we have our different categories: clinical, safety, practice, ethics, theory, group, macro, supervision, administration, research, all of these. Then I just want to pop on some free study resources if you were wondering. There are some free ones. One is the Quizlet. That's a link. You can click that. There's a Quizlet just for practice questions. I'm not sure if it's still linked and still working because typically it will come and go sometimes when people put questions that they probably not supposed to put on there. So sometimes it stays and sometimes it doesn't. Then you have the behavioral health app, and this is the app right here, this purple heart with the hand. Different people have different feelings about it, but for the most part, it is something that I think would be beneficial in terms of understanding how to, understanding the content. So there are questions for just content. And then, of course, the ASWB is going to be the best for the actual formatting of what it looks like on the exam. And then here are some wide variety of YouTube channels. If you can think of anyone that is not listed and you found helpful, please drop it in the chat and let us know, because that's how we really get to understand. Okay, and I'm going to skip the tips because I want to just get right into it. Yeah, let's get into it. So the question is going to be displayed on the screen. What I want you to do is we'll take about 45 seconds for each question. This just gives you a little bit of time to read it through. Because we don't have the poll tonight, I normally have the poll, but because we're on two different platforms, we're just going to look at the screen. And what I want you to do is read over the question, use the like method that we just went over, and then we're going to come together. If you can, please do not put your answer in the chat until I let you know the time is up, just to give everyone time to review the question. All right, go ahead and put your answers in. What do you think it is? Okay, so tell me, as you're putting your answers in, tell me what you think the type of question is. What type of question is this? You can go ahead and drop it in the chat. Okay, I'm seeing intervention, clinical, or practice. Okay. So let me ask this question. Who is your client? The family. Perfect. So this is really important. You need to know who your client is so that you won't be tempted to service the wrong client. Sometimes you're working with an individual and they bring up like all their family stuff, and then you're trying to treat the family instead of the client that is actually in front of you. And then other times you want to make sure that if the family is your client, that you're not just treating individuals in that family. So good. So I would say direct practice is good. You could have also said group, because family therapy kind of fits under group in terms of it's not individual. So either one of those would be perfect. Now tell me, if you can, in one sentence or one phrase, what is going on here? And when I say that, A lot of times people will give me the presenting problem. Sometimes that's what I'm saying, and then sometimes it's not what I'm saying. What I'm saying is I want you to, in a couple of words or a phrase, tell me what the actual problem that you're addressing. Right? So we know like the backstory, know what's going on. But like what needs attention? Okay, I like that. Change in behavior, adjustment. Mm-hmm. Communication, lack of knowledge, loss, grief, family dynamic has changed, transition, adjustment, family issue due to changes. Okay. A change in the father's behavior and communication. Yeah, and what does it all stems from the husband and the medical event that we're looking at, right? That's when everything started to kind of unravel, if you will. So when you're thinking about the presenting problem, you want to think about it with, okay, what is my presenting problem, right? You want to think about the onset, right? When did it happen? And in this particular question, the onset was really the crux of what we need to know, right? So because the husband is suffering from this medical illness, that's when all the behaviors start to change. And it's not just the husband that behaviors are changing, but it's all of the family that is changing because of what's going on, right? So the husband is having some issues with rage, okay? No interest in personal hygiene, fearful of being alone. The son is having issues, saying that she's overprotective and bossy. Um, the son is also, I'm sorry, the son is saying the mother's having issues. She's overprotective and bossy. And the son is also having some reaction, being angry about how his parents are interacting. So all of the dynamics are changing because of this event that's happening, or because of this situation, not really an event, but a situation that's happening in the family. So should the social worker do first? Okay, so we have three options. How you want to move through this now that we know exactly what we're supposed to be addressing, right? We have some family dynamics that are changing. We have this event that is happening. Then you want to get rid of what it absolutely is not, right? And that means what I would never do, okay? Or what is not fitting with what's going on. So when you read the last sentence, the social worker should first, okay, well, I revealed the answer. The answer is A. But when you see what the social worker should first do, you want to put them in order. So arranging for treatment sessions, create a situation which places the husband in an independent role. First of all, both of those just have to do with the husband. Perfect, Tiffany. Yes. They both have to do with the husband, has nothing to do with the entire family. And we know that when we're working in a group, or especially in family therapy, being able to understand each person's perspective about what happened is key. And because we know that that starter, right, that onset was the brain disorder, right? What are the feelings about that? Because we see the behaviors that seem to stem from it. But if we can understand what they are feeling and what they're going through, that would be perfect. Yes, good. Okay, let's do two. Think about, do your like method, and also think about what is happening in terms of what type of question it is. Keep thinking about that too. Okay, going to put your answers in the chat. As you're putting your answers in, tell me what type of question this is. All right. Yes. Recall. Yep. Human behavior. Yep. Perfect. And yep, Erickson. Faye, you beat me to the punch. Yes. Yes. Psychosocial development. Perfect, Tiffany and Erickson. So you would have had to know something about this. This one was like really clear. Hey, this is definitely it even says psychosocial development. So you knew exactly which theory to pull the information from. And we know that with Erickson, it has these dilemmas or conflicts at each age group. So what's really important is going to be the age. Typically, with human behavior questions that are about Erickson specifically, it will be asking what the current age, what stage is the current age of the client. But sometimes it could also ask about future stages. So you would have to know, even though it gives you the age, what stage are they in now? What's the upcoming stage? But typically it's going to ask you about what is happening. And these three stages in particular are very similar. So once we get into developmental theory session, I'm going to tell you age and stage is so important. So the answer is A. Industry versus inferiority is the answer. Also, you're going to learn that Dr. Boone is visual. So I have a lot of colors. So my teal, just like my little, oh, wait a minute, this way. Just like my little logo is teal. That's going to be your key concepts, and it's also going to be the answer. The red is what I eliminated first, and then the yellow is always going to be my distractor. Sometimes I base the distractor on what typically people pick, and then sometimes I base it on what it should be. So industry versus inferiority is the one that matches up with 9, that age group. So if you had trouble with this, then you probably need some more studying with human behavior, because this is a very basic level. And what you would have needed to know is all of the ages and stages of Erickson and memorizing those. Sometimes it's difficult, and it does depend on your learning style. One of my graduating students that I taught, she did spoken word to help her remember things. So sometimes you have to be creative. That's probably the most creative I've heard so far. Spoken word. I was like, really? I'm gonna see if I can get her to join me on a live so she can do her spoken word. All right, let's go to 3. Gonna give you 45 seconds. Let's see what you can come up with. Okay, go ahead and put your answers in. Tell me what type of question. Let me know what you got rid of first. Safety. I agree. I agree. I agree. Okay, abuse safety question. Got rid of C first. Yes. Assume that the mother is coaching the boys to strengthen her custody case. And then A, encourage the mother to discuss the allegations with the boy's father, right? Because none of those have anything to do with what you are supposed to be doing. So this is a safety question, and we know that mandatory reporting is also ethics. So it's like both. But the reason why I really like making sure you know which questions are safety is because they are a little bit different in terms of how we process them. Safety questions have to have a safety answer, and you want to make sure that you're addressing that safety concern. When it comes to mandatory reporting, in the real world, we may report all sorts of things. On the exam, it really wants to make sure that we know what happened before we report. Because when we call CPS, Child Protective Services, we're going to have some information before we call them. So it can't just be like, I had a gut feeling something's not right, right? It has to be what happened and who did it. So we have to know that. And this one was very clear about what is happening and who did it. So we were able to immediately report this. The answer is B. Also, we will be doing 10 questions total. So we're on 3. So if you're just joining, you haven't missed too much. Okay, let's put 45 seconds on the clock. Go ahead and read it to yourself, and I'll let you know when to put in the answer in the chat. Okay, let me know what you think. What's the answer? What kind of question is this? Yes, diversity, specifically LGBTQ plus, absolutely. Unit 1, yes, it does fall under human behavior. Perfect. And what I will say, I have been requested to have a class just for LGBTQ. I'm not sure if I'm going to run it live or if I'm just going to pre-record it and post it on YouTube. But that will be upcoming as we go through the different topics. I'll make sure before we finish in June that I will post a video on this because it is a population that is diverse and traditionally has not been represented on the exam as much as it is now. And so that can give you a little bit anxiety if you're not sure what questions may look like about this population. And so understanding the terms is going to be definitely good. So gender fluid, perfect. Yes, A was a distractor. And in the rationale, I give you all of the definitions of each of the topics. Also, as you go to the next one, I'm going to post the glossary from the Human Rights Council They're really good in terms of making sure that you have what you need. For their glossary is really good. Is a glossary provided day of the exam? What I would do is I would check with the center. Yeah, unsure if this option was only for non-English speaking students. Yeah, I think I'm not sure about that, but I did hear that before to get a dictionary, you need an accommodation, and then now you don't need an accommodation to get a dictionary. So I would check with the new testing center to see if that's just something you can request once you get there. That's a good question. If anybody knows the answer, please chime in. All right. So I was able to put the Human Rights Campaign, not Council. Sorry about that. Human Rights Campaign. They have a glossary of terms that's really good. Also, they just have a lot of information if you're unsure about what best practices are. So it's just good to peruse, but definitely start with that. Make sure you know those terms. Okay, the social worker's best response is to. Best is one of our friends that we may not like, but best is saying that there are these are all good options, but what is best in terms of the situation? It could be based on the situation or based on some type of knowledge. Um, so that's what it is. It's a little different than first and next. You're not putting it in order, right? So you want to kind of understand that. So let's see what it says. A social worker at a mental health clinic is working with a client who's diagnosed with narcissistic personality disorder. The therapy relationship has developed over the past 3 months. As the client demonstrates progress, the social worker is feeling extreme romantic attraction toward the client. Yeah, absolutely. So ethics all day. Best is most beneficial for the patient slash situation, correct? Yes. Yeah, most of your questions are going to be client centered. There are some times where it will be about you as the social worker, but it's ultimately about the client, right? So in this situation, like I saw, I'm pretty sure I saw it. Let me just make sure I didn't see the opposite of what it is. Nope, I don't see that. I see countertransference. Perfect. So anytime you have any countertransference, it's ethics. So it's good to know that, right? It's good to know that if you have a reaction to your client, that is countertransference and that's ethical. Anytime your client's having a reaction to you, that's transference, it's ethical as well. So let's review the answer, and then I'm going to answer Dolores's question. So we have immediately set up an appointment with the agency supervisor. Absolutely. Because when it comes to when to consult a supervisor, countertransference and transference are both on the list. I have a list of when to consult your supervisor, and they're on the list. I got rid of B and C first. Plan to discuss the romantic attraction at the next session. Never. Okay. Because that makes the session about me and not the client. So that's something we would not do. Ask other coworkers if they have availability to transfer the client. So I got rid of that just because we're not at that point yet. So when it is appropriate to transfer the client is after you've seen your supervisor and you've tried to address whatever that is that you are feeling could harm the client. So we are going to kind of follow that process first. Yeah. So you want to talk to your supervisor. Maybe it's something that you can uh, resolve, or maybe it's something that you do. Maybe your supervisor says, "Hey, let's transfer this client," but you want to talk to your supervisor first to help you figure out what to do. So it's not saying that you can't decide what to do on your own. This is just how the exam is set up, that they want you to go to your supervisor about this type of situation, right? In order to understand what to do. So again, it's not that you may not transfer it, but you're not going to transfer that with your own power. You're going to go to your supervisor and see what the best action should be. And then I had our distractor as devise a strategy for termination since the therapeutic progress has been achieved. Because there has been some progress. So that might have been tempting to you because there was some progress. And so you might be like, okay, let me just terminate. Let me just terminate them. They're okay anyways. They're doing well. So let me just terminate them. But that's not the best response in terms of what to do in this situation. Perfect. Anytime you see an ethics question, you want to make sure you know what code you are pulling the information from in terms of what you should be doing. All right, let's do 6. Go ahead and put your answers in. I see some answers coming in. I see we're maybe a little torn. Let's see. Maybe a little torn. Those ethics, they get you. They really do. They get you. Okay, what should the social worker do first? So that means we're going to put them in order. I recommend when you put them in order from last to first. From last to first. So we have a youth. We have informed consent from the parents to discuss with the youth. It's a teen that talks about their sexual orientation. What should we do about that? The parents are saying, hey, I want to see my teen's records. A lot of things going on. ADBC. Okay. Is that from, okay, last to first. I like that. ADBC. Okay, let's look at it. So really what you're dealing with is how do you respond to the request? Anytime anybody requests anything of you, you are going to have some type of response. Okay. So I would actually say that in terms of responding to the request, that D is not a response. So discuss with the client how they're coming out to their parents is time sensitive. Like, I don't think we're ever going to do that. Not only are we never going to do that, but it doesn't have anything to do with the request that's being made of you. So I would actually say D is out. We don't even need to order D because we're not going to do D. That would be like, hey, don't you want to tell them? I think you should tell them. There's no statistics that says telling them faster is going to be better. So yeah, let's get rid of D. So I think we all agree with that. Then we have give them all of the record, give them a little bit of the record, or figure out what the law says about what you can do. Right? So the answer in this case is C, follow appropriate jurisdictional regulations. And that is good because when I wrote this, I was thinking about the case. I always don't remember what state, but I was thinking about the case where there's a new law that if a student has a disclosure about sexual orientation that you cannot tell the parents. Like it's a law about that, right? In other jurisdictions, that might not be the law. In some jurisdictions, you may need assent, right? You would maybe ask the teen, is it okay to share the records? What would they like? Things like that. So you wouldn't protect the therapeutic relationship. Well, yeah, I would say that is protecting the therapeutic relationship if you're saying no to the parents. Is age a major factor? Yes, 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 yes. Typically when we think about assent, we're thinking about that teenage realm, right? If they're 7, 8, we're not necessarily asking them for permission to share what we talk about to the parents typically. But once they get to that older age, assent is a best practice. So again, that's where those jurisdictional regulations would come in. Right, yes. On releasing the information, yes. So it depends on what state you're in, or even could be what county you're in terms of what information as a school social worker you can divulge to the parents. Or even if it's okay for you to give the information, there may be some procedural things that you should be doing first. Like, for example, documenting that the student said it's okay to tell them. That might be something that your school or your jurisdiction, it's a requirement. So that's what that one means. And you may see that on the exam. I know on my exam, although it was like 11 years ago, it had that on there in terms of whatever your state says. That's what you go with. But you do want to check that. Okay, the parent had consent. That is why I said B. Yes. Allow them to view only parts of the record. So the reason why it's C is because it's first. So I'm not saying that you would not do B, but what I am saying is that you would do C first. Okay. So just for educational purposes, different states require this information to be released, like sexual orientation. I'm saying that I know in the news, I think this was definitely last year, they made a law that said you cannot release that information, even if the student is telling, if the student is telling a school staff, they are not allowed to give that information to their parents. So it's like privileged in communication, kind of. But that is just that state. It might not be all states are like that. There may be different rules for what to do. So even though you do have informed consent, and you probably would not, yes, test world, that's it, you got it. And you probably would not get in trouble for doing A, really, or B. C is like, let me check it out first, right? And that's kind of what we said before, right? Protecting that therapeutic relationship. This student is disclosing to us sensitive information. So we don't want to Unless we felt like the student was in danger, of course, that's different. But with this is like not a dangerous, not dangerous. It's just this, the parents are probably wondering like what's going on. I want to know what y'all talking about in there, right? They being a little nosy. But that's something that happened. So what I wanted to make sure you knew is that there may be different rules for different, even agencies, but different states in terms of what you can release as that school staff. And also, even though it wasn't a selection, assent is good to get too. It's good. I'm going to make some more questions about assent too. Y'all gave me a good idea. Any other questions on 6 before we move on? So I'm not saying that B and A are not correct. What I'm saying is that before we do B or A, we're going to do C to see what it is. Also, if C was not option, B would be the answer. Yeah, I would say that's probably the best answer out of all of them. If we took C out, it's probably the best answer. But A might not be wrong either, right? Because like we said earlier, they do have informed consent. A might not be wrong either in terms of what you could do. I would say the best answer would be to know what they like. If informed consent was obtained, A is not correct. But first. Mm-hmm. Yeah. So when I get another question about assent, I'll post it on my Instagram so you can see it. Hot topic. We wouldn't turn over records immediately. I agree with that. I think in terms of our protection of privacy, it's just in general, we should be cautious, make sure we are being able to maintain that confidentiality, that privacy when appropriate, right? And there's nothing in this scenario which leads us to believe that the client is in danger or in any unsafe situation where we would need to give them any information. So I agree. In general, we typically don't just turn over records. In general. Stay in the moment. Do not add to the vignette and allow your mind to go. But what about? Yeah, I agree with that too. Sometimes people process better that way, so that's why we can touch it a little bit. But I do agree that sometimes when you say, well, what if this, what if this, what if this, but I get it. You're trying to figure out how to adjust your thinking for each scenario. So I definitely get it. Okay, let's do 7. So we have 4 more, 7, 8, 9, 10. So Kendra on Facebook had a good question. What if the client, this is for the last question, what if the client wants us to tell their parents so their parent will accept their orientation? So I would say that the answer would be to discuss a little bit about that, right? They want us to, basically let their parent know. So let's discuss that. Why? What's going on? What's the thought process behind that? Okay, what type of question is this? In the assessment phase? All right, come on. I like it. Yeah, it looks like everyone got this one right. The answer is C. When you have a first question or next question, these are things to keep in mind. Safety, feelings, assessment. First, next questions may have to do with safety, feelings, or assessment in that order. So we want to address feelings when there are feelings in the scenario. So I want to preface that. Sometimes when I give a formula or like a helpful tip, we like to be hard fast on it, like it's a calculus formula. So it's like, you'd be like, well, sometimes you try to fit it in there. But there are feelings in this question, so we're going to address the feelings. So normalize the client's feelings of grief and loss. And we know grief and loss is not just death, but in this instance, it's the retirement, the loss of her friends. She don't really have a social life. She's isolated. So all of those things, we want to normalize that as a process of grief and loss first, and then we might be able to do some other things. All right. I think we all agreed. So let's do 8. Okay, go ahead and put your answers in. What phase of practice are we in? It's a practice question. What phase of practice are we in? Assessment. Great. So I think we got it down to 2 because I'm only seeing 2 answers. I'm seeing an A and a B. All right. So what's our presenting problem? Depression. Perfect. And what should we be doing? I know we're in the assessment phase, but what should we be doing in order to address that presenting problem? What should we be assessing in order to address that presenting problem? Okay, I like that, Brianna. Factors contributing. Hmm. Right. What's causing the depression? Okay, I like that. But I saw that we were split on A and B. So sometimes what happens is when I go through it, I ask you the question, you give me the right answer, and then you pick an answer that's not what you just said. So when you say factors or what's causing the depression, that actually would be A. Conduct a comprehensive assessment, right? Because you're trying to figure out what is causing the depression. We do know what he just said, right? And we're like, okay, let's just go with that, what he just said, right? But that could be a piece of it. That could be it. But if we only go with that first, then we don't get to see what else is happening. So A says, let's collect as much information as we can. B says, let's go with what this disconnection first. Like this is why there's a long history of depression because this person is disconnected from the gay community. Yes, looking at all areas of his life that could be contributing factors triggering the depression. Yes, this was a rarity. Typically, assessment, there's not like multiple assessment options. Typically, there's like one that's really good. But in this case, I do want to point out that when you're thinking about assessment, especially right at this stage where it doesn't say, because I saw someone ask, does it say, oh, yes, this is good too. I was thinking, I'm sorry, let me go back. It doesn't say what session we're in. Specifically, it doesn't say what session we're in. So that can be annoying. Safety feelings assessment. So I would propose to you that B is assessment and not feelings. That's what I would submit to you. That both are assessing, but A assesses more than B. And also, that makes sense. Okay. Because sometimes it's when we go through them, sometimes it makes sense, sometimes it doesn't. Right? So I understand if sometimes you're like, what? But I would say that B, explore the client's disconnection. Yeah, he reports being disconnected. He's not political. After all, it is no different from being straight, except to have sex with guys. Okay, so he's not really even saying anything that he feels about it. He's not saying anything about his feelings. So that's why I, when I say safety feelings assessment, I want you to know that sometimes there's no feelings to address. So you don't want to make things a feeling. You want to see if there is feelings, but you don't want to make it a feeling and be like, you know what? He's feeling disconnected. Let me explore the feelings. You're really looking at it's really more of an assessment. Like, okay, tell me a little bit about what is the disconnection? You're trying to feel more about it. Let me see. So B is the contributing factor. So with B, right. So B, you're saying not that it's a contributing factor, but that's what you're going to really focus on first. Whereas A is saying, let me just see if there's anything. Like, what could it be? It could be this, or it could be other things that have nothing to do with this, right? No, so the answer is A. We're saying A is first. And I think also with B, you're thinking, well, I'm going to address what the client just told me. So I'm going to respond and say something about what they just said. That also could be why you were like, oh, B, because that fits with the question. But A is, let me figure out what's going on. Like overall, instead of just focusing on that one thing. So both A and B are assessment. A is more assessment than B. So that's why it's first. And B would probably go in A, like you would do all of it. Okay, let's do 9. All right, what type of question is this? Group, perfect. Tell me some things we should be thinking about group. Group dynamics, yes, we should be thinking about group. Typically with a group, you want to keep everything all. Come on, Michelle. The group is the client. Always keep all group members involved in the process. Absolutely. Everyone, not just one person. Group members handle group affairs usually. Yes. Unless it's like a extreme safety issue, somebody's trying to beat somebody up, somebody's cussing somebody out. Okay, we're not gonna necessarily say, hey group, how are we gonna calm this person down? You're gonna intervene. But normally you're gonna bring everything back to the group, even if it's these types of feelings that seem a little insensitive. A little insensitive. But all feelings must be considered and should be talked about. So the answer is A. Plan to discuss the issue with the group at the next session. We don't want to meet individually. We don't want to turn our group into individual counseling. We don't want to do that. C was very tempting because it's super social worky, right? Something that you would probably definitely do. But in terms of the group dynamics and what we know about groups, so because it's so little to know about groups, you can literally say to yourself, what are some things I should keep in mind when I see group questions? And that should help you stay within your knowledge of what happens during a group. All right, this is our last question, and it's a community one. Also our favorite. All right, it looks like we were all in agreement. It is A, convene a team of community members to obtain input on priority services. Anytime we're getting input from our clients, whether it's community members, group members, individual clients, it is good. So client-centered. Since the state funds are used for community members, they should be involved in this process. Absolutely. Perfect. So the last one is A. And this is about the amount of questions that we would go through in a live class after we've kind of gone through the information. So the next topic, well, next week is how to get started. Then May 9th, we start with ethics. So we're going to go through the code of ethics, and then we're going to have 10 questions live, and then you'll get 10 questions for homework. So that's how all of them go, except for the practice question only. It's just questions. June 20th, we typically go through, I think it's 15 or 20, it might be 20. So June 20th, it will be a little longer. It'll be we'll go through all 20 on June 20th. But these next few are going to be those topic ones. Also, I'm giving my goal a goal by the end of May. If you're taking your exam a little later than May, I'm trying to get my full practice exam in effect. So keep me accountable. You are so welcome. Do you have a YouTube? I do have a YouTube. Yes. Yeah, and next week what I'll do is I'll go through the slides about how to get started because I want to make sure you are on the right start, okay? So that's why I want you to come out. Even if you started and you feel like you're a little stuck, I want you to come out so that we can talk about how to get started. It's really important to me that before we dive into all these topics that you know how to craft a important study plan. Like if your study plan is a little shaky, then I'm going to help you with that. I want to make sure it's a solid study plan so we can set you up for the best success. And then I'll also put some practice questions on there too. So we can go through those as well. Go through some new ones. I'll put some new ones on there. Can you post the like method? Oh, yes. Here's the like method. And also, nope, that's not what I wanted to do. I'm also going to email out the recording. And here is the handout one more time so you can download it. And I'll put that on the email as well. Okay, so join me next week. I'm not going to have any technical difficulties next week because I remember my password. I'm going to remember my password. Okay, have a great night, and I will see you next week, 7:30. All the other classes that we do is going to be at 7. It's just these two. Trying to make my son's soccer practice, so it's at 7:30. But once we get going, it'll start at 7 because I want to make sure we squeeze in all the good information. Have a good weekend, and I will see you next Thursday.